Okay. Hi, my name is student Dr. Katie. What brings you in today?
Hi, Katie. I think I have an ingrown toenail on this toe.
Okay. Oh, that sucks. So when did this start? When did you notice it?
I noticed it about a week ago.
Okay. What happened?
I was just walking my room and then I stubbed my toe.
Okay. And can you point exactly where on your toe it hurts?
Right here.
Okay, right on your lateral nail fold, okay, of your right hallux. So is it kind of constant pain throughout the day? Does it come and go? How is it?
Constant.
Pretty constant, okay. And how would you describe the pain?
I would say it's throbbing.
A bit throbbing, okay. Has anything made it worse?
Putting pressure on it.
Putting pressure on it, okay. Has anything made it better at least?
Just keeping pressure off.
Keeping pressure off, okay. Does the pain kind of radiate up your foot, or does it just stay local in your toe?
Local.
It stays local, okay. And you said this happened about a week ago, correct?
Correct.
Okay, and how would you rate the pain on a scale of 1 to 10?
5 out of 10.
A 5 out of 10. Oh, that's annoying. Okay, so now that we've talked a little bit about that, I'm going to ask you some questions about your past medical history right now. Have you ever, do you have any hospitalizations? Have you ever been in the hospital for any reason?
No.
No? Okay. Have you ever had any major illnesses, either when you were an adult or a child?
Nope.
No? Okay. Are you all up to date on your vaccinations?
Yes.
Okay, awesome. Do you take any medication?
Only ibuprofen.
Okay, what do you take the ibuprofen for?
Just moderate headaches.
Okay. Do you have any allergies?
No allergies.
No allergies. Okay, have you ever had any blood transfusions?
No.
Okay. Have you ever had any surgeries?
No.
No? Okay, you seem emotionally fine, alert, and aware, oriented. Love to see it. So now I'm going to ask a bit about your family. So especially talking about your parents, your mother, father, any siblings you might have, and grandparents. Has anyone been diagnosed with a pretty significant disease, like diabetes, heart problems, anything like that?
None of those.
None? Okay. That's awesome. So now I'm going to ask you a bit about your social history. So what do you do for work?
I'm also a student.
You're also a student. That's cool. Now, Nicole, do you try to exercise?
I do about 3 times a week.
Okay, that's good. How much sleep do you get?
About 6 to 7 hours.
6 to 7 hours? Okay. How's your diet?
Good. Yep. Husband keeps me fed.
That's awesome. So you're married. Good to see it. So do you try to practice safe sex with your husband?
I do.
Okay. Pretty sure everyone's monogamous.
Mm-hmm.
Okay. Do you smoke?
No.
Okay. Any other illicit drugs?
No.
How often do you drink?
About a social drink once a month or, yeah.
Okay, once a month. That's pretty good. Do you have any pets?
No pets.
No pets? And when was the last time you've traveled?
Over Christmas break, we went to Arizona.
Oh, pretty recently. That's awesome. Okay, now that we've talked a bit about that, I'm going to start the physical exam. Do I have permission to touch you?
Yes.
Okay, so first I'm going to have you just kind of scoot back a little bit. Okay, so first, skin temperature, warm, cool, cool. It's pretty cold in here, so that's pretty normal. It does feel like the area around your ingrown toenail is a little bit warm. That's around what we'd expect. I'm gonna quickly check your cap refill time. Less than 3 seconds on all toes. Awesome. Now I'm gonna check your pulses, okay? Dorsalis pedis, bilaterally 3 out of 4. Posterior tibial, bilaterally 3 out of 4. Okay, next up, I'm gonna just put my finger in there. Popliteal on the left leg, 3 out of 4. And the right leg, also a 3 out of 4. Awesome. So I am noting some mild edema, again, right around where your ingrown toenail is, again, pretty consistent. I'm not seeing any varicose veins, any major discolorations. Skin seems elastic and good, and I am noting hair growth, which is awesome. Now I'm going to do a little bit of a dermatological exam. On your dorsal side, I'm not seeing any major lesions, nothing like that. Some redness around your toe, again, pretty normal. Okay, I'm not seeing anything between your toes, so no interdigital lesions. Now plantar foot. Okay, plantar feet are fine. And plantar leg, also fine bilaterally. Awesome. Now I'm going to do a quick musculoskeletal exam. First, I'm going to assess the strength of your muscles. So I'm going to have you just press up against my hands, okay?
Okay.
Okay, strength for flexors, 5 out of 5. Strength for extensors, 5 out of 5. Again, 5 out of 5 for everters. 5 out of 5 for inverters. Awesome. Now I'm going to just do a quick little range of motion test. Okay, your first MPJ on your right foot, being careful not to touch your ingrown toe. Looks good. Your mid-tarsal joint. Looks good. Subtalar joint. Subtalar joint neutral. Okay, and now ankle joint. Looks pretty good. I'm gonna do the same on this foot. So, first MPJ, range of motion looks pretty good. Mid-tarsal, same thing, good. Okay, your subtalar joint, okay. Neutral, pretty good. And now your ankle joint. Awesome. Now I'm just gonna do a quick test for any equinus you might have. Okay, so first up, I'm gonna do your right foot, put you in subtalar joint neutral, and then I'm just gonna dorsiflex your foot, okay? Now this will be easier if, okay, because you need this leg to be bent. Subtalar joint neutral, and okay, I'm not seeing any evidence for equinus on your right foot. And for your left foot, same thing, subtalar joint neutral. Pretty good. And bent, subtalar joint neutral. Also pretty good. Awesome, not seeing any equinus. Now I'm gonna do a quick neurological exam. I'm gonna start off with the monofilament test. So basically I'm gonna poke you on your foot. Just tell me yes when you feel it. Please close your eyes.
Okay. Yes. 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 Yep. 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 Yep.
Okay, and
Yep.
okay, right foot, all 10 points were felt.
Yep. 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 Yep.
Okay, and left foot, all 10 points were felt. Next up, I'm gonna do a quick sharp and dull test. So basically what I'm gonna do is I'm gonna touch you on your foot with either a sharp object or dull object. This is what the dull feels like, and this is what the sharp feels like, okay?
Okay.
And now just tell me if it's sharp, if you're feeling sharp or dull.
Sharp. Dull. Dull. Sharp.
Okay,
Dull. Sharp. Dull. Sharp.
wonderful. Okay, so next up, I'm gonna do a quick test for proprioception. So proprioception is just where's your body in space. So now I'm gonna take a toe, tell me which foot I'm holding in it and if I'm moving it up or down.
Right up. Right down. Left up. Left down.
Wonderful. Now I'm gonna check your Babinski reflex. So this might tickle real quick. Okay. Reflex is absent bilaterally. Okay, now I'm gonna have you scoot forward real quick, and then I'm gonna check your patellar and your Achilles reflex, okay? 1, 2. Okay. 1, 2. Okay, perfect. Patellar reflex are good bilaterally, and Achilles reflex also good bilaterally. Awesome. So Nicole, it does seem like you do have an ingrown toenail. So what I'm going to do is I'm going to prescribe you a corticosteroid cream. You're just going to apply that 3 times a day for just a couple weeks and that should help the swelling go down. Another thing you're going to do, I'm going to have you do is you're going to soak your foot in some warm water, just 10-20 minutes, do that a couple times a day, and between that and the cream, that should help. So basically, an ingrown toenail, also known as onychocryptosis, just is caused by repeated microtrauma from like wearing shoes that are too tight or from even cutting your toenails wrong. So you want to try and cut your toenails just straight across, no cute little almond shapes. I don't think we'll need any radiographs or anything like that, but I will see you in a week after you've been doing the soaking and the cream. And if these don't work, then we'll reassess and we may consider a nail avulsion, okay?
Sounds good.
Awesome. It was nice to meet you.